Working with dental implants and full arch cases, I have seen more than my liking in regards to numerous dental disasters. One category being those that are doing the traditional all-on-4, full arch cases. Secondly, those that are, say, for example, going out of the country to try to retain less expensive, with the same results, or less expensive options with the same quote-unquote results, and how that plays out. Lastly, you're looking at, malplacement of implants with doctors that want to join the bandwagon of the dental implant ride, so to speak, but aren't really 100% competent in implant placement or how to efficiently do that. Initially, when people come to me, they've heard of the term all-on-4. It's a very commonly used term. And nowadays it can go by all-on-4, all-on-X, all-on-6, teeth in a day. Our term is immediate teeth for the same thing. But primarily, all-on-4 with 4 implants only is a lesser expensive way of going about the same full arch implant process. When you're using 4 implants, the idea is that to make this work, whether it's with zirconia or PMMA or resin acrylic, okay, as far as the type of teeth or, that you're using to attach to those implants, doesn't really matter. The concept of having 4 implants is the minimum amount of implants that you need to make this successful. We've seen a lot of people that have gone that route of, in the past, doing, let's say, all-on-4 and just using those 4 implants because that was either the way they did it at the time when they started years ago, or they were just dealing with a cheaper option to keep costs down. One or more of those implants just didn't make it for one reason or another, and now they have to basically spend thousands of dollars replacing those teeth. And patients are relatively upset with that because it's not something that was explained to them. It's not something that they expected along the way. The next category, I would say, has to do with people that are trying to look for a less expensive option and therefore see these ads for, let's say, Costa Rica or Mexico or Turkey, to go out of the country to get their dental work done. I have seen, and compared what others are offering to what we're offering on the same, apples to apples level. And I tell people, please, do your comparisons thoroughly. Make sure you're looking at the same things that you're comparing one to another. I usually tell people the lifespan for like a hybrid or a PMMA set of teeth is maybe about 5 years. Well, again, people don't know this going in, and while they may look beautiful and they have a little bit more flexibility than zirconia would, they don't last as long. Lack of knowledge base as in part of, the implant dentist. Without proper implant placement or without the frequency of doing this on a regular basis so you would know how to avoid problems, angled implants appropriately around certain areas in the arch, not everything just going straight vertically up. You encompass problems that not only, can give the patient pain, discomfort, and other extenuating issues after that, but then they can't even fix it because in order to fix it, they may lose the opportunity of being able to have viable implants to begin with. When you are comparing one practice or one doctor to another, know specifically what it is that you are getting. Know specifically how many implants they're going to be placing. Does the amount that they quoted you include everything, or are you going to be, oh, surprise, now you have to pay $12,000 for zirconia. We forgot to include that because we were just quoting you on your temporary teeth while you healed. I'd love for you to come into a consultation and learn about what I can do to help you and give you back your smile.